Welcome to the Unite series, where faith meets wellness and a journey to wholeness. Join us as we explore what it means to care for our body, mind, and spirit, guided by God's wisdom with the insights of incredible experts. Discover the path to a healthier you, grounded in faith. This is more than wellness. This is God's design. We pray God blesses you richly as you enjoy the Unite series, connecting our wellness, body, soul, and spirit. Hey, Fearless family, I am so excited about this episode. We are in the Unite series, which is connecting our wellness, body, soul, and spirit. I don't think there's anybody that probably shares the same passion of connecting body, soul, and spirit than my guest today. I'm honored to welcome Dr. Megan Malone to our Unite series. She's a graduate of Logan University, but also is an expert in women's health through chiropractic care. She has a holistic approach, which is why I was so adamant about having her on this series, because I really believe that we're going to dig into some things today that are going to open your eyes to a different way of viewing your body and holistic wellness. So we are thrilled to welcome her today. So Dr. Megan Malone, welcome to Fearless Tips and Talks.
Good to see you.
Good to see you too. So offline, we were sharing right before we hit record. And I have a list of questions here that I thought I was going to ask you. And as we just got to organically talk and share about what's happening in our worlds and how they collide and what we're passionate about, I just felt this shift of like, I'm going to ask you some different questions that I think I was going to ask you before. And so first and foremost, I want our viewers and our listeners to kind of get a heart for you, to understand you. What makes you tick? What makes you so passionate about this whole body, soul, spirit alignment? Share us a little bit about your passion, your why you do what you do.
Yeah, that's such a great question. So I was always going to go pre-med. Like that's what pediatrician, that's the route I wanted to go. And then, God shifted things, right? I had a friend in high school who's like, you got to come hear my mom's boyfriend talk. He's a chiropractor. And I'm like, no way, I'm not doing that. And it's so funny because, I look back now and I'm like, man, what a jerk I was. I like went for the free donuts. It was in high school, right? So I got my plate of donuts. I'm in the back. I'm like, legs kicked up, like whatever. This is going to last 30 minutes or something. What surprised me was that he was talking about how he was able to help babies with things like colic or reflux or those kind of things without the use of medication. I'm like, what? I've never heard of that. Like ever, being someone who for years had like heartburn and things of that nature. I just was like, there's another way. I was never told. And so ultimately that kind of led me toward chiropractic school. And then because I'm slightly OCD, I decided I had to get a job working for a chiropractor to see like, was this true? Or was that guy kind of, you know what I mean? Was he just like hyping us all up or what was the truth? And I mean, while I worked for the chiropractor for like 4 years, all of I was doing my undergraduate, it was awesome. Like we saw all sorts of different things. My personal like migraine headaches and heartburn and things like that just gone.
Really?
Oh yeah. Yeah. And so then I get into at Logan, I'm doing all this stuff. And I remember I got into a clinic, it's like your early residency program. And, I'm ready for all the babies. Like I had taken all the classes and I'd done all the things, and all of my friends were getting the babies, like all of them. It'd be like, there's a baby, like you got it. And then there's the pregnant woman. And I'm like, just boiling. Cause this is what I've been planning for this since I was 17, you know what I mean? And it's not happening. And I got so frustrated. And, then, I have this patient who comes in, she's like between the age of 19 and 20, and she has a condition called endometriosis. You're familiar with that? It's terrible menstrual problems, right? So it is considered an autoimmune condition, and this person is just like suffering like crazy, right? So she's bleeding through her clothes. She's having to take extra outfits. She's dry heaving. She's, just in so much, I can't even describe the pain. And she's gone the gynecological route, and if you've gone that route, if you've experienced this, that oftentimes birth control is like, that's the thing that you do. I cannot remember how many forms of birth control that she had utilized. It was just like I don't even know. But the last straw was the Depo-Provera shot for her, which is routinely used for endo, or can be. And she had a 6-month long cycle after that. Like she bled nonstop for 6 months. And so she's just like, I'm fed up. Like none of this is working. I'm miserable. And then, they were talking about doing other drugs or surgical, and she's just like, I can't do it. So that's how she ended up in the clinic. And, we took some x-rays of her. We start checking out her sacral alignment. She'd fallen off of a horse, I don't know how many times.
Wow.
So she had a lot of things like that. And immediately, probably within her first 30 days or so, of treatment. So her first actual period after starting chiropractic care, she was greatly reduced in her pain. So it wasn't gone, but it was significantly better. And then, we start working at different things and it's getting better and better. And it was so wild to me because I'm like obsessed now. I'm like, wait, what is this? So every clinician on scene was getting me being like, what do you know about this? What do you know about this? Guess what, Christy? They didn't know much. We actually know very little about women's health. And 12 years ago, we knew less. We knew way less. And so, anyway, it became like my thesis upon graduation. I became ultimately obsessed. And that's what really led me down the female reproductive route. But what's so funny about that or interesting about that is I really feel like your purpose comes through pain. Your passion can oftentimes be the thing that you would say, oh, I would never wish that on anybody else. But here it is. Well, that whole story, that was my sister's story. And that was her. And I know because of her going the chiropractic route that she still has, her uterus, her ovaries, like those kind of things that oftentimes can be taken from women who have, proliferative endometriosis. And my 11-year-old nephew, I believe, is here because of the care that we had done. And I remember whenever he was born, because I'm there, and as he was born, I was holding him and it had finally hit me, it was like, at that point, I don't know if I would have known that was like the words of God that were coming through, but I do now as I reflect upon it. It's like, this is how you get to help the babies, Megan.
Aww.
Do you know what I'm saying? Because it was about taking care of the mamas first.
Yeah.
And when you take care of the moms, then the babies are healthier and they're better and they can thrive more. You know what I mean? And that's like, wow, that was it. And so, for the last, so I've had my clinic has been open 10 years, last month or whatever. And it's always been a highlighting focus of female reproductive. But, when you look at female reproductive, it spreads out, right?
Yeah.
You can have all sorts of thyroid, anxiety, digestive, eczema, whatever, because we're not just that simple. That'd be cool. If we could just say, oh, that's it, and we fix it, that's not how that works. So that's where my passion comes from. I really think that it had to be someone so close to me. It had to be something I needed to become obsessed with. And that's really ultimately what led me there.
Yeah. And I think it's sweet that you say obsession. I see passion. I have the honor of being your patient and have watched you work, have watched you speak to me and listen to what's going on in my body to be able to treat me. And I think it's extraordinary to watch. You have a gift, and I'm so thankful that hard situation that you had to walk through brought you to this place, because now I see you helping thousands of women and patients. Right. And that is such a beautiful thing. Now, I've been very open and honest about my journey with health, and that I have an autoimmune disorder. I have Hashimoto's. I have half my thyroid. I've talked about this openly. And see, here's what's interesting. What happened for me is I almost had a spiritual and soul journey before I had my body journey. Yes. And so I'm sure you see a lot of patients like that. But now that I am very in tune with my body, and I know that part is equally as important as my spirit and my soul, nurturing all of that, I'm on this passionate journey too of like, friends, like we have to pay attention to our bodies. We have to pay attention to our bodies. So walk me through sort of the overwhelming themes you're seeing your patients coming in with, especially like fear, anxiety related. How is working on the body? How is pain? Because here's what I'm trying to say. We live in a world right now, and we're going to get to a little bit of this in a minute, but we live in a world right now where the doctor and what's going on in your body and the pill that you're taking is way more important than being in tune with what's happening inside of you. So walk us through, why is it so important for us to pay attention to our bodies and to listen to what's going on instead of just somebody else telling us what to do with our bodies?
Oh my goodness. Well, I think that this is probably one of the most kind of, if you were to say what's a big frustration that you experience as a clinician, is that we don't have this truth and understanding that mind, body, spirit, those are all one. They are not separate compartments at all. And so the patient is co-currently experiencing all of those things. That's why you say, yeah, you had that experience. I'm yeah, you were. I'm going to say this, Christy, and this is just my opinion, but my opinion is that you were actually experiencing all of those at the same time, but your level of awareness, your conscious mind, was only allowing you to see certain things at certain times. Do you know what I'm saying? But there is no difference between it. This is how we can use modalities like things like acupuncture and stuff as well, because we know that there is a relevancy to all of those things. But I definitely feel like, anxieties, and it really comes down to fear. You know what I mean? When you kind of just take anything, any kind of emotion or whatever that you're not congruent with, and you kind of bottle it down, it's some form of fear. It's, unworthiness, unlove, just something, right? And it all compiles. It's everything is all at the same time. This is what's so complex, because when you go into your doc, if they're not thinking about, okay, so we have this, we have this, we have this, it's really important to understand what's happening subsurface level. Mm-hmm. Oftentimes the patient doesn't realize it. I think that we can all agree that something like anxiety can have physical and psychological type of, effects, right? We know that we can be in both places at once, right? We can be experiencing anxiety internally and expressing it externally with sweaty palms or heart palpitations or whatever, you know what I mean? Those don't work outside of each other though. Mm-hmm. And that's what I think is probably the hardest element for people to understand, is that you're going to experience all of that all at once. So I don't know if that really answers fully what you're asking me, but I think that it's a big, void or space that we're not filling. Do you know what I mean? We're not talking about that element.
Well, I think what I feel called to just champion our fearless community on is that you can advocate for yourself.
Sure.
You can listen to your body. We've been taught that no, the doctors know more in our bodies than we know in our bodies. And I've become frustrated, and I have deep respect for traditional medicine. So if you are a traditional doctor listening to this right now, please don't, I'm not trying to bring offense. I'm trying to bring awareness. Yeah. And so it's you go to a neurologist for this, you go to a gastro for this, you go to, a primary care for this, and it's all segregated instead of looking at the body as one whole compartment thing. Right. And so the neurologist doesn't know what the primary care is saying. They try because they link charts, but they're not paying attention and they're not listening. And it's so incongruent, and we're not really digging up what's really happening in our bodies. Right. And when you go see you or somebody that practices functional medicine, chiropractic care, they're looking at it all. They're looking how this affects this, how this affects this, how this looks at it. And it sometimes is a slower journey, because sometimes you can just pop a pill and that thing will go away for a bit, but you're just hiding what's really going on, right? Sure. But for you, it's a journey. It's a journey of unpacking and listening and showing. So I know when I first started chiropractic care, I was I feel about this. It's a little new agey, or maybe not. Maybe talk to somebody that is I don't want you to snap me, crack me. I think it's weird. How does that really help? Just give it the elevator pitch for why people should believe in what you do.
Yeah. So the cool thing is, I think with chiropractic or just with any of these things, you don't actually have to believe in it for it to work. So that's always nice, because you don't have to go in being I totally am bought in. I definitely think that it would your buy-in affects your level of or ability to participate in what you're supposed to do at home. It's always been so funny to me whenever people have called me their quote, like witch doctor, because I'm like, that's so weird. I never have given you like some kind of magic thing. It's always like, okay, so you need to change your lifestyle and we need to commit to this. You know what I mean? And there's like this laundry list of things that you need to do, you know, when we're trying to really go through that process. I'm like, I feel like that's kind of the opposite approach, but whatever. You can call me whatever you want because again, you can get those results. I think the important thing to think about in the chiropractic space is that it's about nervous system functioning, right? So nervous system regulation, and your brain runs everything in your body. Like, so all of your organ systems and everything are ran through your brain. So if there is incongruency there, your body is not going to feel well. We know what being in fight or flight feels like, right? Most of us understand that, you know, we get into this like kind of hyper levels of awareness, like our organs are getting less blood flow because the blood flow is going to go out to our extremities, you know, and things like that. So the body's going through a physical change from a nervous system, you know, challenge. This could happen on smaller levels too, though. You know, we could see this when the patient is maybe has what we call a misalignment in the spine. Now their body, their nervous system, their brain is trying to communicate, and it's like, something's up here. This is not, it's like not quite sending and receiving the way that we want to, you know, so it could be less, it could be more signaling, but the patient might be experiencing all different types of things. In chiropractic, we're focused less on what the diagnosis is and more about trying to get the body into a state of what we call dis-ease, which means that the body is into a state of ease, not in dis-ease, which is what happens when we have the misalignment. So if the body's in ease, it's relaxed and it's open to its own natural ability to heal. What's so interesting to me is you and I can be in the same room together and we could be both exposed to some type of virus or whatever, but one of us might get it and the other one doesn't. Yeah. What's regulating that? You know, what's choosing that? That's called your innate immune system. You might not show anything at all, but undoubtedly there is exposure. That's what's so interesting. And so what we want to really always do in my brain is look at how does the body naturally function and how can we promote and optimize that function as opposed to trying to go the other route. So I focus on inside out healing as opposed to outside in. So the idea is not that I'm going to be looking at this symptom that you have, like Hashimoto's. I'm not going to go directly try to fix Hashimoto's. What I'm going to do is ask the body, what ways might this have been challenged and what ways I might support it? And if I support it effectively enough, might the body just decide that it's going to work better? You know, it's a different paradigm completely than what most of us have been exposed to. I think that's where the real challenge, you know, comes in, is because we have been, from the time we were little, we have been taught to think about things from a symptom standpoint. Yeah. And I'm going to argue that a patient can have no symptoms and still be unhealthy. You know, and that they can also have symptoms and be healthy. Like if you were to catch a virus, you would undoubtedly get some symptoms if your body was going to go through that response. So we could get, you know, fever or fatigue or nausea and vomiting or whatever. And the presence of those symptoms actually means the body is doing a healthy function. And so if I were to have a patient coming in who actively has a cold or whatever, I am going to actually encourage the body to continue to do those things. Does that make sense? American Pediatric Association is often talking about how we need to stop trying to reduce fevers because it's not helpful. You know, long term, it's not helpful because we want to encourage the body's natural function, right? So there's an example of how you can have symptoms, but be functioning from a state of health, right? Or at least the systems are healthy, right? But we can have, you know, the other true. We can have the patient who had literally no symptoms of anything and then has some kind of crazy thing happen. Their thyroid, a terminal illness, or whatever. Like, what explains that? Yeah. So are symptoms really the only metric? And we argue in the functional world that no, they're not. That we should be looking at what is collectively happening. And that's where that holistic type of approach comes in. So that's when we're asking questions about how is your emotional well-being? You know, how is your spiritual well-being? Like, that's why we're also bringing those other elements or facets in, because we know that we can feel that, right? We know that we can have challenges with those things, and those things can create actual like physical pains in our body. what it's strange, isn't it? It's something like anxiety, how it creates all of these physical things.
Yeah.
You know, it's like, wow, that's interesting. Well, yeah, of course it can. And I think the real trouble with anxiety is like, it can open up in a spiral into all sorts of things, right? Because we can have many different reasons for experiencing symptoms similar to anxiety. But I personally, when I, look at it, I go, that's so interesting. So the thought processes or the spiritual health or the emotional health of the patient is creating physical changes.
Yeah.
Shouldn't we be aware of that?
Right.
Wouldn't it be helpful for her to know that, her low back problems are actually because maybe she's feeling unsupported at home?
Wild. And it's like when you start to put those connections in, you almost tweak yourself out like, no, like I can't tell you how many times I've sat with people and I'm like, hey, that chest tightness that you have is actually anxiety, or, the restless night sleeping that you're having, or the pain in your neck is actually anxiety. I remember when I went to the emergency room and all the symptoms I was having, and the doctor came back and was like, you've got severe panic and anxiety disorder. I was like, say what? Like, there ain't no way all of this stuff I'm experiencing right now is just anxiety. But one of the things that I love about you, and I would say that this is probably fairly new to your thought process practices, you want your patients to be in counseling as well, because you know that if they're seeking their emotional health, that their physical health will also start to fall back in alignment. Am I true in saying that?
Yeah.
That you encourage that?
Yeah, I would say that for the majority of them, it's really kind of interesting because I don't feel that way with my under threes, right? So, it's like they just, it's so funny to work with babies because they just are, you know what I mean?
To be a baby again.
They haven't had that, like, what does this mean kind of, complexities that go in with it. But I would say, well, first off, why wouldn't everybody be, having that? And I think that the need for like things like therapy or counseling has become so much more prevalent, probably because of our community, right? So we don't have as much of the community stuff. So, if we were to compare and contrast like a postpartum mama now compared to maybe what that was like 40 years ago, there's a good likelihood that she would probably have friends who are also like in a similar space, and they might be meeting up regularly and talking through a lot of things. We don't have that as much now. But yeah, I would say that like when you are going through physical healing, we end up starting to kind of poke some of those bears a little bit with some of the emotional healing. Mm-hmm. Sometimes it's not, this overwhelming, like the patient can't handle it, just in their daily prayers and meditations and things like that. But sometimes it is. Sometimes I'm working with a woman, especially with reproductive disorders, there's a high prevalency to trauma, particularly sexual trauma in those patients. So it's going to be really helpful to have someone on hand who can help her to process, what am I learning here?
Mm-hmm.
As she's becoming more connected to her physical body, she starts to realize there was so much more going on that she was not opened up to, Well,
and I'm hopeful, I'm prayerful right now that people that are listening, there are light bulbs going off and they're going, wow, I didn't know that perhaps my endometriosis could be related to some sexual trauma I had at some point. Or I didn't know that my back pain is actually because I'm completely stressed out at work. I'm in a toxic environment, I think what we're like overwhelmingly just trying to sound the alarm on is like, friends, our bodies are trying to tell us something. And if we can just get surrendered to that, because it's not the world we've lived in, where we've been told to pay attention to our bodies.
Right. Exactly. And, in my world, we're looking at really like three main factors, right? So we call them the 3 T's. And interesting enough, they're thinking about adding some more elements onto that. But like there's trauma, there's toxins, and there's thoughts, right? So physical traumas, right? So the patient has had, maybe they've fallen downstairs, maybe they had a crazy birthing process, maybe they were in a car accident, maybe they were a horseback rider, whatever. There's all different ways in which we can physically like hurt the body. And then there's the toxins, hormones, which is more of like a chemical thing, right? So what we're putting into and on the body, what we've been exposed to, those can cause stress inside of the body and create a maladaptivity. And then we also have the thoughts process, right? Which is where then we're going to get into the emotional, spiritual stuff. And that can go wide spectrums here, right? But the really curious thing to me is that we aren't looking at all of those with the patient on the regular. You know what I mean? Like as in a societal thing, like you go in to your doc and you're just going to get like your kind of well check. We're not kind of checking in on those factors. And I'm really making it a point to check in on each one of those factors and to be asking the patient about what kind of changes might have been happening, right? You know, right now I'm working with a patient she's a young girl who's been having a lot of anxiety and self-worth problems and things like that. And at first I was like, oh, this is like, we got some hormonal stuff going on here. To be honest, we started doing this stuff and she just really was about the same. That is so weird because outwardly it seemed like she's about 15 and it seemed like that's exactly what the problem is going to be. But, you know, for me, this is the job as a physician is to sit back and go, that's not quite what's on point. And so I sat down, I did some prayer with it. And I'm like, okay, what else could be happening here that I'm not seeing? And so I'm going through those things. And I keep coming back to it. And I believe this is spirit that's coming back. It's like, ask about mold. And I'm like, okay. So, I get on the call with mom and I'm like, hey, listen, I just feel like we might need to ask and see if there's been any exposure to mold or anything. She's like, oh yeah, we had to leave our last house because of that. And so I'm like, all right, cool. So this is a completely different approach, right? And right now, the last I had heard, so I think we have a follow-up in a couple of weeks, but last I had heard is that she was greatly reduced in these like anxious symptoms when we started addressing the mold toxicity, right? So I think it's just really helpful to understand that it's like, it could be any one of those factors. It could be all those factors that could be happening at the same time. That's why it's so important that we have, we're looking at like a team or a holistic approach, which means we're factoring in all of those things. You know what I mean?
I've got two things that are coming to my mind. First and foremost, what a blessing it is to have a physician that seeks God on behalf of your patient. Yeah. That's amazing. I mean, that is true because you are going to have access to discernment and wisdom that only God can give you. Right. And the God of the universe knows what's wrong with our bodies, period.
Totally.
And so just hallelujah. Yeah. And it's one of the reasons why I trust you is because I know you are going to ask God on my behalf. The other thing that I feel like is incredibly important, I can also ask God on my behalf on what's going on and bring it to you and say, hey, I'm feeling like this may be it. Am I crazy? Can you use some of your wisdom to help me decipher and discern this? Yeah. And so that's another reason why I feel like Christian care is such a beautiful thing because God wants to heal our bodies. He wants us to live healthy as best as possible. We live in a fallen world. There's going to be sickness. There's going to be disease, those kinds of things. But he also wants you to live heaven on earth as best as possible. And so I think there's something so brilliant and beautiful about us asking Jesus, what's going on with our bodies? And I don't believe that if you didn't have that connection with the Lord, that the mold would have popped up in your mind.
Maybe, but it may have taken a long time, right? We may have gone through 6 to 8 months of trial and error or whatever. And then I may have been going back through patient history and been like, what is missing here? You know what I mean? And we may eventually have stumbled across it. True. Or we may never have. And that's really that's why I think any of my patients are fine. Like, yes, please invite anything in to help us find answers. When you were talking about you have that ability, that autonomy to be able to do that, I think that that has been such a big thing that hasn't been nurtured very well in the medical world.
Hey friends, I just wanted to take a moment to interrupt to let you know that the Fearless Tips and Talks podcast is part of a ministry called Fearless Unite. Our mission is to help you find freedom from fear and anxiety in a world that feeds it. We are rolling out a new initiative called Soul Shepherd, which is a mental health advocacy movement in our community. We are very serious about decreasing the mental health crisis that we are facing. And we're going to do this first by starting with teenage girls, one body, soul, and spirit at a time. If you want to learn more about our Soul Shepherd initiative, go to fearlessunite.com/Soul Shepherd. This will also be linked in our show notes. Now, back to the interview.
So I feel like that's something that hasn't been nurtured as much in the medical field, right? So I'm going to set the stage for you a little bit with that. So the patient comes in and they say, I think this is, I've been, Googling or whatever. And look, guys, I'm going to be completely honest. Anytime we hear the Google thing, we're a little bit like, oh, okay. But
Megan, can I time out real quick? In my book, A Nervous Breakthrough, I literally have a whole part that I was like, don't Google your symptoms, especially if you deal with fear and anxiety. It is just a boundary that I don't cross because it inevitably leads to so much panic and fear. I would rather go to you, who's much more wisdomful, and say, this is what I'm experiencing. Will you help me work through this? And I'm sorry for interrupting you, but I remember when we first saw each other, I was like, look, I have medical anxiety. So I need you to be very careful with my heart when you share things with me. And I need, you be very careful, and you listened and you loved me well. And you know that that's something I struggle with. So you're bringing things up very cautiously when you talk to me. And I appreciate that about you so much. But anyway,
but I think the thing is here is that it's really important as a physician to not be dismissive when the patient says that.
So good.
Because, first off, we need to be helping. My job, I feel like, so doctor in Latin is educator, right? And so I feel like part of my job is to be helping you to understand what your physical body is telling you. And so I love this portion of my job is that, like, when we start with the kids little bitty, I have kids that have come into me since they were in utero, right? And so when they start to tell me things about, like, well, Dr. Megan, my leg or my tummy or my this, we'll start asking about, so what kind of choices have you been making? Is there anything that you've noticed? What happened? Oh, so today you had gummy bears. Do you feel like that often when you have gummy bears? Do you know what I mean? So we're starting really little there, right? But I'm trying to get them to do the work for themselves and know that they can, right? Like, it's okay for you to question and ask, what is going on here? I feel like there's something more. I've had many patients who have said, I've prayed about this and I think this is what's going on. And I'm like, who am I to say that's not what's going on? Let's do our job and let's start really looking at all the pieces and start pulling them out. But this is where, I know you've spoken a lot about how, you get hurt in the church. I think this is how medical hurt can start too. When we're not acknowledging
let's go there.
Does that make sense?
Yes.
When we're not acknowledging that you do have things that you're experiencing, you have things that you're feeling, like, that's huge. And I need to respect that you are going through whatever you're going through. Even if medically I'm kind of going, I'm not really seeing how that all pieces together. Even if it doesn't make sense to me, even right now, because sometimes things don't, and they do actually end up making sense later. I'm like, you remember that? So I have a lot of times when this has happened where people have come in and they've been told that they are their diagnoses, and I'm not saying that that's not relevant. What I'm saying is that in order to step outside into healing, you might want to let go of your attachment to it in order for that next step to happen, but if we don't honor that, then we're telling the person, then we're essentially affirming to them that you don't know what's going on and I do, and that's the only way. And that feels very disempowering. And that just doesn't feel congruent for me. Instead, for me and in my practice, I really want to sit down with the patient and understand, what's going on? What do you feel like is happening here? And what other obstacles might we need to be overcoming? Maybe there's things at home or whatever that we need to bring into congruency. You know what I mean? And I think that's where we can run into the fear. The person doesn't even want to come into the room kind of thing. I just did, I don't know if I actually posted it or not, but I just did a video or a little reel or whatever about that, like how people are so nervous about getting testing done. I don't want to get the testing done. I don't want to get the testing done. And I was like, what? And I sat down, I kind of pondered that. And I'm like, oh my goodness, it's because they're not seeing it as an opportunity for us to grow together. I look at anything that comes back. I'm like, okay, opportunity. We've been presented with information and now we can choose which route we're going to go with it. But because a lot of times when you get something done, it creates like this level of finality. This is it. This is the only way. This is what you have to do. And if you're not congruent with it, if you go, well, I don't know if I want to do that. Unfortunately, I've run into a lot of the position where patients have been dismissed and saying, well, if you don't do that, then go on. And I'm like, I don't like that.
I want to give my own example. I remember being told by a primary care physician that my thyroid will eventually give out completely because I have half of a thyroid. And this is what science says. Science says that someday my thyroid will completely give out and I will be completely dependent on medication for the rest of my life. Sure. Just hook, line, sinker. That's the way it's going to be. And something rose up in me in that moment. And I said, I'm not going to accept that.
Yeah.
I believe my body can help myself. Like, I believe that if I take care of myself and I make some changes and I do some different things, that won't be my story.
Yeah.
And I don't think the doctor knew what to do with me at that moment. But that was a moment in my life where I was like, I don't know that I like traditional medicine as much as I've always thought, because they'll tell you one thing, but as I started digging about like, well, I need to not have gluten anymore and I need to not have dairy as much. And when I start doing these things, I feel better. And when I got rid of caffeine, I started feeling better. And when I exercise regularly, I start feeling better. You know, another example is cholesterol. I'm still trying to learn all this, and we don't have enough time to break down cholesterol in this podcast. But I was also told, like, I need to be on the medication. I have to be on the medicine. Like, it is dangerous if I'm not. And so it's like, but my, like, inside my gut feeling was like, no, there's some things you need to get to the root of. And when you figure that out, your cholesterol is going to get figured out too. But this is just the paradigm shift, is why I'm so thankful that you're on this platform right now teaching us there are other ways. There are different ways for us to heal our bodies. And do we need traditional medicine still? Absolutely. So please hear us. We're not saying throw that out. One thing I do love about you is you're very respectful of that. You're very respectful of the teamwork approach. And so when you were talking about just like it makes you angry, passionate when people get medical hurt and because they're not being heard, I look at our work together as teamwork, right? You may be more educated, but I'm also living in my body, and you 100%. Can't understand that unless I'm open and honest with you. And so you do a beautiful job of just opening the door to listening and learning from your patients. And that takes a lot of humility. So thank you for that. But share how that has helped usher in healing.
Well, I think that I think the premise to this is that we are all a little bit different, right? We all have different circumstances and situations. So I don't know how many years ago, it was probably like 4 or 5 years ago or whatever, I kind of got obsessed with this idea of like, you can have identical twins, split from the same, but they can be completely different. They get different emotional things. They get different physical problems. It was really interesting. And so it's like, wait a second. There's even if you have the exact same cell that's like splitting and creating life, like it's completely different, which means that, anxiety symptoms are going to present in you much different than they're going to present to me, and their root and cause are going to be different. And that's okay. But the challenge with that is it doesn't fit into a model of, oh, this is exactly what it is, so here's the treatment.
Yeah.
That's the challenge. We don't have, you know what I mean? So that's where it's allowed for extra healing, because we end up figuring out like, oh, that's interesting. So for you, actually the gut health was like a slam dunk, right? But for this person over here, that same protocol or approach didn't quite do it. This is where the chiropractic part really shines, because nervous system balancing is not treating the problem. It is just, it's simply allowing the body to be in a state of ease, which means the body is in a better state of healing. And then when you combine that with like herbalism, which, I love my herbs, like I got so many different tinctures and stuff. what I think is so fascinating about those is that those don't directly go in and do like one thing. They do broad spectrum kind of things, right? So they're going to create a balance in maybe the hypothalamus and pituitary signaling, right? So they don't go in and like directly like kill something or do this or that. They just have supportive elements so that the body can better do that, which is why, utilizing some herbs can be so fantastic for the patient, because like after a couple of months, you start to go, wow, that's not even a thing anymore. That's so interesting. But it didn't directly go in and, kill something or change something. What it did was it established more balance in the body.
Something interesting about you is you do the chiropractic care, but you're also functional you have continued your education in functional medicine.
Correct. Yeah.
So talk a little bit about how you use both of those to come in with your care so people understand the difference.
Yeah.
Because it's like, are you a chiropractor? Are you a functional medicine doctor? What are you, Dr. Megan?
Yeah,
what are you?
Like everything. You know what I see myself as? Like whatever the patient needs in that moment, if we get too much into like the spiritual or therapy thing, that's where I'm like, okay, hang on. Like
I need to call in a counselor. Yeah.
This is where I have resources, but yeah, that's so after, doing chiropractic school, I also started to pursue. So I have a master's degree in nutrition and human performance. And then it really led me into this understanding of like, wow. So like food is really the medicine of the body. And when we can replace deficiencies or heal toxicities, the patient just functions better.
Right.
And what does that look like when the patient functions better? I mean, then we are again, I believe that the body is smarter than I am when it comes to being able to heal whatever needs to happen. And so instead of trying to go in and trick the body into doing something else, what I want to do is I want to encourage the body's natural physiologic processes as much as possible so that then it can do the healing for it. So for most of my patients, what this looks like is a combination of chiropractic and nutritional recommendations. Maybe we'll do some testing. Like it's just kind of all across the board. It's like, you start to come in and the patient needs so many different factors or things. We might be utilizing acupressure points. I might be teaching acupressure points to the patient so that they can go home and stimulate different organs or releasing energy or whatever, because we can, because why wouldn't we? You know what I mean? I'm going to encourage all of those different like factors. So that's kind of what it would look like for in my office. But, in some other, if you're going to a chiropractor, they might only do chiropractic, and that's beautiful and amazing. And then you might go to somebody else for, functional care. That's okay too. I think it's just knowing that you have options.
Yes.
I think when I work with patients, the number one thing that I'm seeing is that when they come in, they're looking for hope. And the hope is that you have decisions. You have so many choices. You have so many different routes that we can go with this. And I have patients that have some really, really crazy chronic problems. And we're looking to find routes to bring them to a better state of health. And we know that not everything's going to be solved, like some things you're just like the body is built differently now. In your case, we have half of a thyroid. Our objective really isn't to try and regrow the thyroid. It's try to increase the longevity of the thyroid that you have.
Right.
In what ways can we take the pressure off of that system so that the body can focus on all of the other healing that it needs to do?
And that brings hope.
Absolutely.
That brings hope.
Absolutely.
Because in all honesty, if what I know now is what I knew then, I would have never had half my thyroid removed.
Sure.
But if I live in that regret, it'll drive, it's straight anxiety. Like even just saying it out loud in front of everybody right now, I'm like, but you bring hope and like, hey, we're going to support what you already have so that we can give it longevity. That brings hope. And that's how you focus with people. And it's beautiful.
100%. Yeah. I don't like the approach that the patient is broken. Just from the beginning, I believe that we were here to live life to the fullest, right?
That's what scripture says.
Exactly. I can't get over it sometimes how much I'm like, oh, I'm so in line with this. But, if that's if that's true, then what we want to do is we want to nurture what we've been, given. That's why I just recently went on this thing where I'm like, I'm going to do a whole like honor thy temple course, because I really want people to understand that these things all coincide, and that the reason that we really want to do that is because I don't like the idea that we're just like dying and falling apart and breaking and all these different things. What if there's another way?
Amen.
Like, I'm okay. I'm open to that. And if somebody wants to be on the other spectrum and they say, nope, I'm going to say that is great. You can have your thoughts and feelings. But for me and like my patients, we want to go and take every little bit of what is working and we want to go, can we make it a little bit better? Can we get it a little bit healthier? But I do want to say this, Christy, because I think this is so incredibly important. People view health as like a thing that they reach. Okay. I'm here. I'm healthy. Okay, there it is. And then there becomes all this stress and anxiety because now we have to maintain it and we have to whatever, right? Health, like many other things, is actually a spectrum. Okay. And so we have these outliers. So we have like a middle line here where we can have variations of health, but if we go too far outside of the median variant, okay, now we're in like unhealth, right? But I think it's so important to not be so obsessed with making your health perfect, because I've actually seen that backfire just as much as the person who completely ignores health too, so what I'm saying is you can create a really ill relationship if you get too hyper focused or fixated on one faction of your life. What you really want to be doing is kind of on a daily, I do a check-in where I'm going to like, okay, before the day begins, I'm going to be assessing like, where am I at, like physically, spiritually, emotionally, you know what I mean? Where do I feel like I need to be growing, like in these areas, what, like, do I need to be putting more emphasis into my social health today? Or do I need to focus more on my physical health? Or is it really my spiritual health, And it's like looking at all of these things as taking equal precedent in our life, but that sometimes like, they fall a little bit below. So I want to go in and I want to correct for that. And today I'm going to focus in on my spiritual health. So what does that look like, So then I start the question with, well, wouldn't it be great if I spent, a couple of minutes reading some scripture or something along those lines? And then I had a beautiful encounter with a patient about something that reaffirms that. Mm-hmm. And I just leave it up to God to see if he'll just kind of present those in those other ways, Same thing physically though, like whatever it is that I want to focus on, I'm just going to go into and assume that it's going to be provided in that day, but my literal intent and awareness to it has helped it, I just really want to make sure that people don't get super hyper fixated, because that's where it's almost like in resistance then. Do you know what I mean? Yeah. And resistance, whatever you resist persists. You know what I mean? So the more that we resist, the more that happens. So if you're constantly fighting to get healthy, health, then sometimes you actually get the opposite, because it's almost like you're acting as though you don't already have it.
That's so beautiful. It's the balance. It's the idea of the balance. And you just perfectly landed the plane for us to close out today. It's the idea of the tricycle, and you've got three wheels and you've got body, soul, and spirit, right? If one tire is flat and you're trying to roll that bad boy through, it's not going to work. And so it's balance. You're asking for balance. And when we prioritize or pump too much air up into one wheel over another, we're going to be lopsided and it's not going to work out. And your approach to health is inspired me. It's encouraged me. It's brought hope. And that's why it was so important that we have you on, so that you could do the same thing for the Fearless community. Megan, how would you feel about praying for someone right now that felt hopeless? That's like, I have no idea what to do right now. Just, you've been there and you know what that feels like. Mm-hmm. Would you offer a prayer to our community?
Absolutely.
Thank you.
Okay. So we're just the big thing when you get into prayer, guys, is like breathe first. Okay.
Oh, I love it. Okay.
Let's breathe. There you go. Just relax the shoulders down and get into it. Okay. So Heavenly Father, thank you so much for being present here in this conversation today. And there are those of us who are listening to this message feeling like we don't have hope and we don't know where to go to for hope. And we know, because we know you, and we know that before we have asked, we are already in recipient of this. We know that the hope is already here. So Heavenly Father, what I'm asking you to do in this moment is to help take the blindfolds off. Yes. Please help us to see, help us to hear, help us to feel where the hope is. so that when we come out of this, the moment that we open our eyes, we have a sense of hope because we already know that it is here. So we ask this in your name. Amen.
Amen. Thank you.
Absolutely.
Thank you for tuning in to this episode of Fearless Tips and Talks. We hope you enjoyed the insights and advice shared today. If you love what you heard, please don't forget to subscribe to our podcast so you never miss an episode. We'd also really appreciate it if you would take a moment to rate and review on your favorite podcast platform. Your feedback helps us reach more listeners and continuing to allow us to bring the best content possible to you. Hey, and we want to hear from you. Check out the show notes and use the fan mail feature labeled "Send us a text message" to share your thoughts, ask questions, or let us know what topics you'd like us to cover in the future. Remember, a life of no fear isn't the goal, but you can learn to fear less. We hope this podcast helps you achieve that. See you next time.